Hi, I'm Joe Graydon.
I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy, where we bring you the stories behind the health headlines.
This podcast is brought to you by Redix Industries, makers of Utterly Smooth Body Cream. 800-345-7339, on the web at uttercream.com. A mysterious illness brought a brilliant oncologist to the brink of death. What lessons can we learn from his search for true healing? This is the People's Pharmacy with Terry and Joe Graydon.
Dr. Neil Spector is one of the country's leading oncologists. When he developed unusual symptoms, his doctors had difficulty diagnosing his problem. A number of missteps led to a life-threatening heart condition.
When Dr. Spector's physicians finally realized how badly his heart was damaged, they said that unless he got a transplant, he could be gone in a heartbeat. What can the rest of us learn from his harrowing experience?
Coming up on the People's Pharmacy, a medical mystery and a message of hope and healing.
First, this news.
In the People's Pharmacy health headlines, adequate levels of the B vitamin folic acid taken during pregnancy help protect a developing fetus from neural tube defects like spina bifida. But too many women aren't getting as much folic acid as they should, says the United States Preventive Services Task Force. The group says less than 1/3 of women of childbearing age take a supplement containing folic acid. Because the need for adequate amounts of the vitamin occurs so early in development, some women might not realize they're pregnant and start with prenatal vitamins in time. So a regular multivitamin with 0.4 or 0.8 milligrams of folic acid is recommended for all women who are not using reliable contraception.
Women should not assume that if a little folic acid is good, more is better, according to a new study from the Johns Hopkins Bloomberg School of Public Health. Very high levels of B vitamins, folic acid, and vitamin B12 increase the risk that the baby they bear could become autistic. The researchers used information from the Boston birth cohort. It contains nearly 1,400 mother-child pairs in which the child was born between 1998 and 2013. The mothers had their blood tested at the time they gave birth, and the scientists found that 10% had excessive levels of folic acid, 6% had excess vitamin B12. Although the investigators don't know why some women had such high levels, they found that these high levels were associated with an elevated risk of autism in the child. The moral of the story seems to echo the tale of Goldilocks in the porridge, not too high nor too low.
When children develop diarrhea, parents are often advised to give them an electrolyte solution, such as Pedialyte, to prevent dehydration. The goal is to replace both fluids and minerals. A new study on more than 600 youngsters between 6 months and 5 years of age shows that a less expensive alternative may also work. They were brought to an emergency room suffering from mild dehydration due to a bout of stomach flu. Half the kids were randomly assigned to get an apple-flavored electrolyte solution, while the other half were given half-strength apple juice followed by the child's own favorite beverage. Surprisingly, the children getting apple juice did quite well and were slightly less likely to require hospitalization or intravenous fluids. Since parents may not always have an electrolyte solution on hand, half-strength apple juice may be a useful home strategy unless a child is quite ill. In such cases, medical supervision and electrolyte support will remain essential.
Runny noses are among the most common health complaints of childhood. Swedish researchers conducted an 8-year-long study to find out if diet has an important impact on this symptom. There were nearly 2,000 youngsters included. When they were 8 years old, the parents were asked about rhinitis, sneezing, sniffling, and runny nose from allergies or without allergies. The kids answered questions about what they ate. Approximately 1,600 did not have rhinitis regularly at the age of 8. By the time they reached 16, about 20% of them had developed nasal allergies. School kids who frequently ate oily fish such as salmon, mackerel, or herring were only half as likely to be sniffling and sneezing in their teens.
Women often worry about gaining too much weight during pregnancy. Those who drink diet soda in an effort to control their weight gain may be risking an unintended consequence, a fat baby. Canadian scientists studied 3,000 mother-infant pairs. The babies were born between 2009 and 2012, and the mothers had answered questionnaires about their habits during their second or third trimester. Nearly one-third of the women reported drinking artificially sweetened beverages. About 5% consumed such a beverage every day. When their babies were weighed and measured at the age of 1 year, babies whose mothers had consumed diet drinks daily were twice as likely to be overweight. This is an association that doesn't prove causation, but an accompanying editorial suggests that pregnant women be cautious about consuming artificial sweeteners. And that's the health news from the People's Pharmacy this week. Welcome to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. When people experience strange symptoms that don't fit a typical condition, doctors may end up puzzled. When they can't figure out what's going on, they may disregard the symptoms or blame them on psychological factors.
If the patient is a doctor, though, it gets more complicated. While doctors may want to be good patients, they are capable of researching their conditions in ways that other patients might find challenging. Today, we'll learn about a doctor who was faced with mysterious symptoms that posed a difficult dilemma.
We're talking with Dr. Neil Spector. He's a medical oncologist, an associate professor of medicine, pharmacology, and cancer biology. He holds the Sandra P. Coates Chair in Breast Cancer Research at Duke University Medical Center. He co-directs the Experimental Therapeutics Program for the Duke Cancer Institute and is a Komen Scholar. His book is Gone in a Heartbeat, A Physician's Search for True Healing.
Welcome to the People's Pharmacy, Dr. Neil Spector.
Thank you. It's great to be here.
Dr. Spector, you have an amazing story to share. Why don't you begin at the beginning and tell us a little bit about your background, your medical training, and then what started to go wrong?
Sure, yeah. My background, I'm a medical oncologist. I do research. I have a laboratory at Duke University Medical Center. I have some clinical responsibilities. I had trained in excellent institutions. I found myself doing a fellowship in Boston at the Dana-Farber Cancer Institute. I was the paradigm of health. I mean, I did everything right. I took my baby aspirin every day. I had a glass of red wine for health purposes. I ran like crazy. I mean, I used to run 10 to 12 miles, probably 6 days a week. I ran 2 Boston marathons. I never smoked, no family history of any diseases. So I was the person who was supposed to live a healthy life well into my 90s. And I had, met my wife in Boston. I mean, life was good. And one particular bad winter, my wife said, this is it. I'm not going to live here anymore. We're moving south, or I'm moving south, and you could stay here, and we'll just commute and see each other.
Sounds like an ultimatum.
And that was before this past winter when the snow was really bad.
Yeah, that's true. So I got a job at the University of Miami at the Cancer Center there, and I came back, proudly told my wife that we never have to shovel again. And within weeks of moving to South Florida, I started having some very bizarre symptoms that I'd never had in my life. And what it amounted to was I had transient episodes where my heart would start racing for no apparent reason. It would, probably 15, 20 seconds. So it wasn't like it lasted for hours. And, the first time, I mean, that happens to a lot of people, although it had really not happened to me all that much in the past.
And as a doctor, I'm assuming that you were measuring your heart rate, and you could say, uh-oh, that's a little too fast.
Yeah, 200, 250 beats a minute is not sort of your normal caffeine rush or, gee, that's a scary movie type of arrhythmia. The problem was that every time I would see a doctor, it would have resolved. Within probably 6 months, I could have written a book on every emergency room in South Florida because I visited most of them, which was very atypical for me. Again, I was somebody who was in excellent shape.
Now, did you have any symptoms other than a racing heart? Because one wouldn't necessarily go to the ER just because you had 20 seconds of brum.
Yeah, although, as a physician, I knew that was not a normal racing heart. In fact, there was one episode where I was going over a causeway, and for those of you who are not medically inclined, one of the ways that you can terminate potentially fatal arrhythmia, which we call ventricular tachycardia, is to do a precordial thump, where you actually take your fist and hit it on somebody's chest. And as I was driving, left hand on the wheel, I was doing a precordial thump with my right hand on my chest because I really felt that it was an arrhythmia that, could have been bad.
You also described driving with your wife and having the classic symptoms of a heart attack.
So that was really the first episode that convinced me. And every time I would talk to a doctor about these rapid beats, they would tell me the same thing. It's stress. You just moved from Boston, South Florida. It's an adjustment, which it was an adjustment. I mean, going from New England to South Florida was an incredible cultural adjustment. But I knew it was more than that. So the first episode that was something very different was we were driving down I-95, and if you've ever driven down I-95 in Miami, you know that's a pretty stressful experience in and of itself. And in the middle of the drive, going 75 miles an hour, I started having chest pain, and it just came on. It was like a crescendo. It started rather mild. Within seconds, it built to this incredible crushing pain, the classic, there's an elephant sitting on my chest. It started radiating up into my jaw. I started sweating profusely, and I was driving. So as I'm driving, I'm undoing my tie because we were coming home from work, and I started to feel queasy. And I thought, this is it. I mean, this is a classic textbook heart attack. I don't know why I'm having this, but this is it. And I started to tell my wife, I had this feeling of impending death, which I'd never had before. I'd taken care of patients who had a pulmonary embolus, where there's this classic premonition of, I'm going to die, and people will tell you that before it happens. But I started telling my wife that, that I loved her, to tell my parents that I loved them, and if I didn't make it through, that, that I loved everyone. And it built to this point where I was lucky, I'm looking for emergency rooms on I-95 and managed to pull off in one. My heart's racing. And by the time when I finally was evaluated, it's the classic, I got in the emergency room, they tell me, okay, take a seat in the back and we'll call you in a few minutes. By the time I was seen, the pain had resolved and the symptoms were gone. And my heart rate, again, had, come down relatively to normal. And once again, they did an EKG and a slew of blood tests and said, it's all stress. And so, but, I had worked 130 hours a week as a resident at Parkland Hospital in Dallas, which was an incredibly stressful experience. And I had never experienced anything like that. So I knew that wasn't the case. They discharged me home. I went back to work. I visited a cardiologist at the University of Miami, and they said, we've got to bring you in the hospital because that just doesn't sound right. They did, again, a battery of tests, an exercise test, echocardiograms. Everything came back normal, and they told me it was stress.
That must have been frustrating, especially as a physician, where you knew in your heart, so to speak, in your body, this is not stress. There's something weird going on. And yet here you are having what you thought was a classic heart attack, and just before you get to see the doctor, everything's fine.
Right.
So how totally unexpected and weird is all of this? I mean, you must have been scratching your head as a physician going, what is happening to my body?
Not to mention it sounds frightening and frustrating.
Yes. No, and I mean, here I'm a physician. My colleagues are telling me it's stress, and I'm telling them it's not stress.
Mm-hmm.
You know, I've published in top-tier journals. I mean, I'm somebody who understands medicine, at least I think I understand medicine. And moreover, I understand my body more than anyone does. And I always used to tell my patients that you understand your body better than any physician will ever understand it. You may not know the jargon. I didn't know the diagnosis, but I knew that my body was undergoing something that was more than stress, and it needed to be figured out quickly, or I wasn't going to get any better and was likely to get worse.
How did you go about trying to figure it out, since obviously the cardiologists weren't getting there?
Well, it was frustrating because none of the blood tests, actually one of the blood tests came back positive, and they ran, you name it, they ran it. Although
Positive for what?
Well, it came back, so they ran what they call an SPEP, or serum protein electrophoresis, which essentially looks at the protein pattern in your body. And sometimes we use it in oncology in particular for people who have a type of cancer called multiple myeloma, which is a cancer in the bone marrow of a certain type of bone marrow cells, because the cells produce abnormal amounts of protein. My serum protein electrophoresis came back abnormal because there was a spike, an abnormal amount of protein in my body. I didn't have multiple myeloma, but my doctors didn't really quite understand what it was. I mean, in retrospect, it was my body was making antibodies against this infection, and the response to the infection was so abnormally high that it actually showed up in this test.
But nobody knew what to do with this
anomaly. But no one knew
anomaly.
how to interpret it. And I actually, for a period, because I'll tell you, after the episode with the chest pain, I had an episode of classic, I never had it before, but I'd had patients who described it, of brain fog. And so for several weeks, I felt like I was literally like in a cloud. In fact, I'll give you an example. I gave a talk, and it was a little scary because I was attending on the bone marrow transplant unit, taking care of very sick people. But I gave a talk, and after I got out of the lecture, somebody said to me, wow, that was a great lecture. And I said, what did I talk about? And that lasted for several weeks. And then it cleared as mysteriously as it came on. And then I knew that this is not normal.
You're listening to Dr. Neil Spector, the Sandra P. Coates Chair in Breast Cancer Research at Duke University Medical Center. He's a medical oncologist and an associate professor of medicine, pharmacology, and cancer biology. Dr. Spector is a Komen Scholar and co-directs the Experimental Therapeutics Program for the Duke Cancer Institute. His wonderful book is Gone in a Heartbeat, A Physician's Search for True Healing.
We need to take a short break. When we come back, we'll find out if Dr. Spector's symptoms were really all due to stress.
What could be more invalidating than being told there's nothing wrong with you, even though you feel terrible?
When Dr. Spector had the first inkling that his problem might be an infectious disease, his doctors in Florida were skeptical, to say the least.
Even when he consulted other experts, they were dubious as well.
We'll find out how he tracked down the infection and learned to become an advocate for himself.
You're listening to The People's Pharmacy with Joe and Terry Graydon.
If you value the health information you get when you listen to The People's Pharmacy, consider subscribing to our email newsletter. You'll get the latest health news and information on upcoming podcasts delivered to your inbox twice a week. Look for the link at peoplespharmacy.com.
Welcome back to The People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. The People's Pharmacy is made possible in part by Red X Industries, makers of utterly smooth creams and lotions that deeply moisturize to make dry skin feel soft and smooth. The number's 800-345-7339, online at uttercream.com.
If you would like to order a CD of this show, you can call 800-732-2334. This is show number 996. That number again, 800-732-2334, or you can place the order on our website. It's peoplespharmacy.com.
Today on the People's Pharmacy, we're talking about trying to get a diagnosis for mysterious symptoms. What happens when a disease is allowed to rage out of control for years?
We're talking with Dr. Neil Spector, the Sandra P. Coates Chair in Breast Cancer Research at Duke University Medical Center. He's a medical oncologist and an associate professor of medicine, pharmacology, and cancer biology. Dr. Spector is a Komen Scholar and co-directs the Experimental Therapeutics Program for the Duke Cancer Institute. He's author of Gone in a Heartbeat, A Physician's Search for True Healing.
Dr. Spector, you mentioned the fact that your body was telling you something. You knew that this wasn't stress. You had this anomaly, this blood test that said, there's something weird here, but nobody knew what it was. And this brain fog thing happened for a couple of weeks. What did you do next?
Well, I continued to seek medical help. I went to several specialists. The brain fog and the abnormal serum protein electrophoresis sort of threw my doctors off because they were convinced I had some malignancy. And so they worked me up pretty extensively for cancer.
Well, as an oncologist yourself, that must have been, what's going on here?
Yeah. Well, I didn't at that point really know what I had, so I was open to any idea and everything. And, as a physician, I understand that we don't always have the answers, but I respect physicians who say, look, I don't really know what's going on, but I'm not going to rest until I figure it out. The problem is when people keep telling you it's stress, you know that you're put into a wastebasket of, oh, he's just stressed. So anytime you go on, and I continue to have arrhythmias, heart, fast rates, in and out of emergency rooms, and, on bold print, although it wasn't on bold print, but I could just imagine on my record was this person is stressed. And then regardless of what you have, you can come in with your arm chopped off and someone would say, well, you're stressed.
A stress-related, whatever.
Well, and it's frustrating because it sounds like it's all in your head. It's a psychological thing. There's something wrong with your brain. It has nothing to do with your body.
Well, and after a while, you start to wonder, am I really just stressed? Mm-hmm. You start to question yourself and you start to question your gut instinct. My gut instinct was screaming, there's something wrong with you. But I kept thinking, well, they've run a lot of tests. Okay, there's this one abnormal test, but no one could quite figure it out. Maybe I should just start meditating. And, I hadn't been running because physically I wasn't up to that. So I'd gone from running, 12 miles a day to being fatigued and just feeling, muscle aching diffusely, like I couldn't do much of anything. So I went to meditation classes. I actually did biofeedback. I did all the things that I would have told a patient if I felt they were stressed to do. Let's try to lower your stress level. It didn't change a thing. I felt a little better emotionally, but it didn't change my physical symptoms. And so as time went on, it was unbelievably frustrating because I was running up against this wall of, you're stressed, we can't find anything wrong with you. And I think the more I complained, the more frustrated my doctors became, probably not only with not understanding what was going on, but a little frustrated with me questioning their diagnosis of stress.
I think a lot of patients have had that experience. When there's difficulty reaching a diagnosis, the patient is convinced something is wrong, and the doctors are trying to tell them nothing is wrong. There's nothing more invalidating than to be told, there's nothing wrong with you, even though you feel terrible.
No, absolutely. And people, when they hear my story, say to me, well, you're a physician, you're a scientist. If that's happening to you, imagine our credibility, which we have no street credibility. So
exactly,
who's going to listen
right.
to us? And I knew the lingo, I knew the jargon. I could say I'm having, tachycardia, this isn't right, I'm having this and that. What is somebody who's selling shoes going to go and tell their doctor, I've got a little pain here and my left tooth hurts more? They're not going to be taken as credible at all. So this actually went on for 4 years, off and on.
Wow.
And then I started to develop sort of new cardiac manifestations, which were my heart rate. I would go to from fast, 200, 250 beats a minute. Again, always transient in nature, 30 seconds, 20 seconds, to then having these periods where my heart would be incredibly slow. Now, in the days when I ran marathons, that wasn't that abnormal. I mean, you're in top peak condition, you have a heart rate of 50, whatever.
Right. Athletes often have those slow heart rates.
Absolutely. So, but I had a heart rate at times in the 40s, and I wasn't doing anything. I mean, I was literally physically, I'm not going to say incapacitated, but I was so debilitated from fatigue that I wasn't exercising much at all. So I knew that wasn't right either. And in fact, I went to one of these episodes I actually captured. I went to a cardiologist. They put me on a treadmill. And he said to me, and he was a famous arrhythmia expert, he said to me, there is something wrong with the wiring in your heart. I don't know exactly what it is, and you may at some point need a pacemaker. But for the time being, I think you need to go on and continue doing what you're doing. Now, that was sort of the first concrete evidence that you don't get an abnormality in the wiring of your heart from stress, at least not that I know of, especially something that appears to be a block that the signal just isn't getting to the muscles the way it should. And so then I really started to press. Of course, I went to the internet. I went and started reading everything I could, PubMed, doing all the literature, healthy individual, cardiac arrhythmias. I had lost some weight. And one of the things that cropped up living in the Northeast was Lyme disease. And so I started pressing my doctors about Lyme disease. And of course, the response I got, because I was living in Florida, was, well, we don't see Lyme disease, even though I'd lived in Boston for 8 years.
Yeah, we never see Lyme disease, and we don't know anything about it because we never see it. So couldn't be,
right.
Or we're not interested.
Yeah, well, it's not on our radar screen. So of our top 100 diagnoses, 99 of which are stress, Lyme disease is off the screen. So we're not even really thinking about that. Now, what happened? So it gets almost crazy when I tell you the story because people don't believe it. I developed arthritis. So I'd never had arthritis during this whole period, and that's sort of the classic Lyme disease, arthritis.
Although the fatigue and the brain fog also fit into a Lyme profile.
Absolutely, absolutely. Although rarer, but the cardiac manifestations as well. So I developed arthritis in my wrist, so severe that I could barely lift up a utensil, swollen, red-hot wrist. And I get put on doxycycline for a completely independent reason. And doxycycline is the drug of choice for Lyme disease. And within 24 hours of being put on doxycycline, the arthritis completely resolves. I mean, 100% better. Now I'm completely convinced that I have Lyme disease. I made the fatal mistake so I figure my doctors in Miami, they don't know what they're talking about because they don't see Lyme disease. They don't think it exists. They're not even thinking about this as a potential diagnosis. I call Lyme disease centers the, quote, experts in the world in the Northeast. They'll remain nameless for the time being. So I called them sight unseen. As a physician scientist, hi, I'm Neil Spector. I'm having these sorts of symptoms. Do you think that this could be Lyme disease? And the answer uniformly is no. We never see this. And the response you had to the antibiotic is a nonspecific anti-inflammatory response that you get with drugs in the tetracycline class. We see this. We give some of those antibiotics for inflammatory diseases, not Lyme disease. Even though you have cardiac arrhythmias, brain fog, weight loss, extreme fatigue, probably fibromyalgia that wasn't classically diagnosed, but I'm having all sorts of aches and pains, sleep disturbance. I developed this dysesthesia, this painful sensation in my heels where I could barely put my feet down on any surface. I'm having this constellation of symptoms that is screaming, there is something wrong in your body.
Dr. Spector, you were a mess.
I was a mess.
And you have this one data point. Doxycycline reversed your rheumatoid arthritis, your inflammatory symptoms in 24 hours. And they're going, nah, it doesn't compute. And you're thinking to yourself,
they're crazy. So at this point, I know, I told you before that I started questioning my own sanity. Now I know there's clearly something wrong, and it's probably I don't have cancer. I'd be dead by now. I mean, if they missed a cancer for 5 years that had caused brain fog and was affecting my heart, then there's no way I'm sitting here 5 years later. And by the way, I'd had rheumatologic workups that were so extensive that there were tests. I mean, even I didn't know of, and they were all normal. They were completely normal, and so not only was I diagnosed with stress, but then the fallback position was you have what they call seronegative rheumatologic problem, which essentially means we don't know what's going on with you. All your classic rheumatologic for lupus, for rheumatoid arthritis, for Sjogren, you name the rheumatologic autoimmune disease, they're negative, but we're going to call you blood test negative rheumatologic. That's even worse than being told you're stressed. I mean, as a physician, I'm thinking, this is a bunch of BS. I mean, hopefully you can play that on the air. But this is baloney. I mean, how could they be telling me this? I know that they're reaching for stars. And again, I would have been satisfied had somebody said to me, hey, Neil, you know what? I don't know what you've got, but let's reach out. Although I reached out to places in the Northeast that you would have said, that's the place you want to call if you've got Lyme disease. And they flat out told me that it was all in my head.
Well, there's this old saying in medicine, when you hear hoofbeats, think horses, not zebras. Tell us what that means and why it messed you up.
Yeah. So you're right. I mean, well, we it's a little different. We say, if it quacks, it waddles, and, it's a duck and not a zebra. I mean, when the symptoms are staring you in the face, you try to put, in medicine, we like to bundle things together. I mean, unless you're really unfortunate and you have 16 different things going on at the same time, one causing brain fog, one causing arrhythmias, one causing weight loss, one causing arthritis that resolves with doxycycline, you could say there's 5 different things going on. Now, that's generally not what we like to do in medicine because generally things tend to happen in a systems. You have an infection. It doesn't just affect one little part of your body. It gets in your bloodstream, bacteria, viruses go everywhere. So you like to put it together, and when you really put this together, it fit nicely with Lyme disease, not with seronegative, we don't know what we're talking about, rheumatologic problem.
Or stress.
Or stress, right. This now is not stress. At this point, the stress, admittedly, my doctors were leaning less towards stress and now towards we don't know what's going on, but there's probably something going on.
Of course, by now you probably are stressed because you're
stressed.
Feeling awful and nobody is coming up with a diagnosis.
Yeah, so you can imagine I'm 5 years into an infection that is raging in my body, manifesting as, affecting my brain with the brain fog, presumably, affecting my heart, affecting my joints, affecting me systemically through weight loss and fatigue. I mean, this is 5 years unchecked infection.
So, Dr. Spector, this Hotsy-Totsy center in New England someplace says...
Several Hotsy-Totsy centers.
They all say, no, it's not Lyme disease because, after all, if it were Lyme disease, you would have gotten over it 4 years ago, right? Because Lyme disease doesn't last forever. This is kind of the classic line on Lyme, as it were, from the establishment. How did you take that further? What happened next?
Well, and you have to remember, this all happened not today with greater awareness of Lyme disease. This happened in the 90s where there was much less awareness of what's going on. I mean, if people think it's bad today, imagine what it was 20 years ago. When I was told that this isn't Lyme disease, it actually just emboldened me. I mean, I became outraged. So some people might have said, oh, those are the experts. They know what they're talking about. Maybe this is blood test negative, virtual disease. I actually read more. I mean, I became, for a period of time, probably more well-versed in Lyme disease than the experts. The myths that were out there. I mean, I actually read the science and debunked a lot of the stuff that people, migrating birds pick up ticks in Minnesota and New England, fly south. I mean, so these were the Floridian doctors who didn't believe that ticks existed. Well, they do exist. They fly south. They drop their ticks off. People travel with their pets. They drop, diseases, vectors travel. There was a time when West Nile virus was in New York, and now it's everywhere. Hantavirus was in the Southwest. These things travel all over the place. So I became emboldened. I became outraged, actually. So I became sort of the consummate advocate for myself. I had been all along, but now I was mad.
So you were now the patient from hell.
I was the patient from hell. I demanded that I be tested for Lyme disease. I demanded, again, it turned out to be to throw my whole diagnosis off track, that the blood test not only be drawn but sent to one of those bastions of Lyme disease labs in the Northeast, because I didn't trust that the University of Miami could interpret a test. So my symptoms started in 1993. In the summer or in 1997, so 4 years later, I developed full-blown what they call third-degree heart block. My heart rate was in the low 40s and was fixed. It wasn't transient. The prophecy of that cardiologist who told me maybe someday something's going to happen to you came true. I went to my doctor. I'll never forget, I was laying on the table. They were doing an EKG recording, and it's coming off. And, now they've got smart ECG or EKG machines that give you the interpretation. It says third-degree heart block, which means that the wiring in my heart was completely screwed up.
Third degree sounds bad.
Third degree is bad. The upper chambers were not connected with the lower chambers. There's a problem. You need a pacemaker because you're not going to be able to survive off of 40 beats per minute. Interestingly, I was working full-time. I was doing everything. Other than I felt like I was running on low octane, I was still living a life. Now I knew I had Lyme disease. That is a classic manifestation of Lyme disease, third-degree heart block. I tell my doctor I want the blood test. And by the way, all the little transient episodes of fast heart rate are captured in a monitor they put on me as ventricular tachycardia, which is one of the most fatal arrhythmias and causes of sudden death. So I could have died 1,000 times over at any moment.
You're listening to Dr. Neil Spector. He's a medical oncologist, an associate professor of medicine, pharmacology, and cancer biology. He holds the Sandra P. Coates Chair in Breast Cancer Research at Duke University Medical Center. He co-directs the Experimental Therapeutics Program for the Duke Cancer Institute and is a Komen Scholar. His book is Gone in a Heartbeat, A Physician's Search for True Healing.
It is time for us to take a short break. Coming up, we'll find out what happened after Dr. Spector had his blood sent off to be tested.
We'll learn what a negative Lyme test really means.
What does Lyme disease do to the heart?
Might an earlier diagnosis have prevented the serious consequences Dr. Spector suffered?
You're listening to The People's Pharmacy with Joe and Terry Graydon. Thanks for listening to this podcast of The People's Pharmacy. If you like it, why not rate or review it in the iTunes store? We'd appreciate it.
Welcome back to The People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is brought to you in part by Red X Industries, makers of Utterly Smooth Foot Cream with Shea Butter, helping dry, cracked feet feel soft and smooth. The number is 800-345-7339. The website is uttercream.com.
To order a CD of today's show or any People's Pharmacy broadcast, you can call 800-732-2334. Today's show, number 996. That number again, 800-732-2334, online at peoplespharmacy.com.
We're talking today about misdiagnosis, inappropriate treatment, and the devastating consequences of Lyme disease.
Our guest is Dr. Neil Spector. He's a medical oncologist and associate professor of medicine, pharmacology, and cancer biology. He holds the Sandra P. Coates Chair in Breast Cancer Research at Duke University Medical Center. He co-directs the Experimental Therapeutics Program for the Duke Cancer Institute and is a Komen Scholar. His book, Gone in a Heartbeat, A Physician's Search for True Healing.
Dr. Spector, you're describing a pretty dire situation, something called third-degree heart block, which sounds like it could be fatal. Some heart rhythm abnormalities, ventricular tachycardia, big words, but also could be fatal.
Yes.
You're lucky you're not dead, and you're having your doctor send the blood test off to New England.
Right.
What happens next?
Well, if you thought that the previous 4 years were frustrating, you can imagine the frustration of what happens next. They're waiting to put a permanent pacemaker in because I'm thinking if I get antibiotics, intensive antibiotics, maybe this will resolve. So send off the blood test. A few days later, my doctor calls me and says, the blood test is negative. You don't have Lyme disease. Now, I wasn't aware enough at that time to question, well, what does a negative test mean? So they put the pacemaker in. I feel somewhat better because now my heart rate is regulated, 72 beats a minute, but it turns out I still have the ventricular tachycardia. And in fact, the first time I ever had a prolonged episode, meaning it didn't just last 20 seconds, it lasted 30 minutes. So I remember after having the pacemaker put in, I'm starting to exercise. I'm starting to think, well, maybe if I truly don't have Lyme disease, and my cardiologist says to me, you will feel better with the pacemaker. I felt better from having a regular heartbeat, but the fatigue, everything else, I didn't feel better. Talk about frustration. I go back to the doctor. He's one of the most famous arrhythmia experts in the world. 3 weeks after the pacemaker, I tell him, I don't feel better. And he tells me, this is almost a quote, because I can still see him telling me this, denial is the most common reaction of someone your age. I was in my late 30s, early 40s. Denial is the most common reaction of someone your age who has heart disease. Like, I'm denying that I should feel better. I'm denying the fact that I'm not feeling well because I'm stressed over having a pacemaker put in. And that's what he tells me. And then he tells me, go on and live your life. Unbeknownst to me, I still have an infection ongoing, but he tells me, you should feel better. Go on and live your life and get over it.
Go feel better.
Go feel better. So the blood test is negative. I don't feel better. I have this prolonged episode of ventricular tachycardia. They take the pacemaker out. They put in a pacemaker defibrillator because I need to be now shocked just in case I have an episode to save my life. I demand that the Lyme disease test be repeated because as I found out, the negative test was not really negative. The negative test, so the Lyme disease is a two-part test. They test, the first part is testing the level of the antibody response in your body. The antibody response in my body was sky high. The second part of the testing is they do what's called a Western blot. They want to confirm that the antibodies are recognizing Lyme disease, the bacteria that causes Lyme disease, and not some other thing in your body. And the CDC, the Centers for Disease Control, has set up very strict criteria for what is a positive second test. Now, they didn't set that up to say that that's written in stone. They set that up, I think, because when people do clinical trials, they wanted to make sure that the clinical trials really captured people with Lyme disease. Now, my Western blot, the second test, did not come back completely positive. So with everything that was going on with sky-high antibody titers, this is the classic duck, they go back to a zebra. They said, it's a false positive. You don't have Lyme disease. We're not treating you for Lyme disease. Go on with your life. I go on with my life. I'm not getting better. I demand a third test. And finally, the third test came back positive, and I'll never forget, it was, Halloween Eve, and I get this call, great news, the test came back positive. Meanwhile, this is 9 months later. And 9 months after, it's so obvious, you don't even have to be a physician to say I have Lyme disease. And so they treat me with, very intensive antibiotics, which was worse than, I think, some of the chemotherapy I gave to my patients. I had a PICC line, an intravenous line placed. My wife gave me antibiotics every day, or when I was, in the clinic, I would sit next to my patients getting chemotherapy.
Well, Dr. Spector, after you were treated for Lyme disease, What then transpired?
So the heart problems, some of the symptoms got better. The heart problems didn't get better. I had the pacemaker defibrillator. I'll flash forward. So that was 1998. I moved to North Carolina in 1998. At the time I had the pacemaker defibrillator put in, I was told I had normal heart function, so the pump function was normal. A year later, I moved to Chapel Hill, went to a doctor, and surprisingly was told I had 10% heart function.
Ooh.
I needed a transplant immediately.
Wow, 10%.
10%, pretty bad.
That's not compatible with life.
It's not compatible. Although I was living a pretty active life. I started taking CoQ10 religiously because I started reading on everything that I could do to improve my health. CoQ10 seemed like something that was important for people with dysfunctional heart. You know, I was put on the usual medications, an ACE inhibitor, beta blocker, but I was clinically fine. So I didn't go on a heart transplant list because I wasn't in an intensive care unit, and I was functioning. I worked every day. So for the ensuing from 1998 through 2009, I lived with 10% heart function. I coached my daughter's soccer teams every year.
It's pretty amazing given the fact that most people with 10% would be in the ICU.
No, I developed 2 cancer drugs. I traveled the world. I worked almost every day. I lived, except for my cardiologist and my wife, no one knew how sick I potentially could have been. I was shocked, defibrillated several times along the way. Thankfully, not that many, but when that happened, it's an amazingly frightful experience that makes you realize that, you know, you're literally one step away from being here and not being here. And you pray to God that that defibrillator works. So, 11 years I function on 10% heart function. My doctors were amazed. And for 10 of those years, I was in pretty good shape. But what started to happen was my heart started to get bigger and bigger, started to dilate. And I wasn't able to compensate for that 10% heart function. And so in 2008, 2009, and every 4 years I'd have the batteries changed. I'd have to go through a procedure. 2008, I noticed that I couldn't walk up the same hill at Duke Research Drive without having to stop, first 1 time, then 2 times, and 3 times. My wife was prepared for a transplant years before I was. 2009, the spring of 2009, I had some episodes that actually could have killed me. I had one episode at UNC Hospital. They thought I had an infection of the pacemaker. They were going to put a PICC line in. I had an episode where they gave me an antiarrhythmic medication because I had a very slow episode of ventricular tachycardia that wasn't recognized as being abnormal by the defibrillator pacemaker. And within seconds of getting this IV medication, amiodarone, my blood pressure dropped to practically nothing. I had 6 hours of low blood pressure. They called my wife in at 4 a.m. saying, "You need to get here immediately." When she thought they were just putting a PICC line in, I'd be home. I was lucky I should have died. 10% heart function, 6 hours of extreme low blood pressure, giving me medication to maintain my blood pressure. I survived that episode, and surprisingly, 24 hours later, I was celebrating my daughter's birthday at Elmo's Diner. For those of you who live in Chapel Hill and Carborough, know that place well. But that was the straw that really broke the camel's back. So June of 2009 was a month of hell. I had arrhythmias 20 times a day, which led to an admission in July with full-blown heart failure. So, I looked like I was 6 months pregnant, fluid developing everywhere. I was in an extreme situation, put in the intensive care unit, and finally told, "You're not going to survive."
You need a heart transplant.
Yeah, a surgeon at UNC came to me and said, who I'd never met, I could sugarcoat this or not. And I said, "Don't sugarcoat it." And he said, this was a Friday afternoon. He said, "You're going to be dead by Monday without a heart transplant or a mechanical, pump, a biventricular pump." And so they transferred me to Duke because Duke has a big transplant program. They argued for a little while about whether I should go on to the transplant list or not because they thought I might have had a pacemaker infection. I pleaded with them again, as the advocate for myself. I don't have an infection. And they put me on the list, and thankfully I had AB blood type, and heart transplants are dictated by your blood type if it's compatible. So AB is the universal recipient. I was able to get the first heart. I had an aortic balloon pump in, so I was in an extreme situation that was maintaining my life, essentially, this pump that was helping my heart function. Within 36 hours of being put on the list, I was in surgery and had the transplant. Within 24 hours after being awakened and extubated, I was walking 3 miles around the halls of the hospital. So it was an amazing period going from near death to walking 3 miles. My journey wasn't over yet. About several weeks after the transplant, I developed fluid around my heart, fluid around my lungs. They went in and discovered that I had a fungal infection. And here I was immunocompromised because I was on medication to prevent organ rejection. And I had this full-blown fungal infection that there were only 3 reported in the literature, so no one really knew what to do. Thankfully, the world's expert in this particular fungal infection is at Duke. I'll mention his name, Dr. Perfect. And when somebody came in and said to me, Dr. Perfect said do this, this, and this, I thought it's like manna from heaven. Dr. Perfect said this. They did this, this, and this. I recovered. It was not easy taking high doses of antifungal medication for several months. I pulled through that. I had some other complications which were not life-threatening. And finally, about 18 months after the transplant, there was literally a day that I woke up and said, wow, I really feel great. And from that point on, I've been, exercising. I ran a half marathon this past November. I'm training for another half marathon in 4 weeks. And, I exercise probably more than I ever did and feel terrific.
Dr. Spector, what is the message for our listeners? What should we all learn from your book, Gone in a Heartbeat? And why Gone in a Heartbeat?
So the message is, I'll start with why Gone in a Heartbeat. Gone in a Heartbeat, and when you read the book at the end, you'll see why it comes full circle. But literally, all of us, our lives hang on a thread. It could change in a heartbeat. And metaphorically and literally, mine changed in a heartbeat. I went from the paradigm of health to someone who was struggling to live and was given 72 hours to live without a transplant. So I think we need to appreciate when we do have health, that is a precarious situation to be in. We don't need to be thinking the sword of Damocles is hanging over us and when is something bad going to happen. But I think we need to treasure and appreciate the health that we're given and do everything we can to maintain that. Exercise, good nutrition, not doing bad habits like smoking. We can't take that for granted. I don't care what age you are. I wrote this book, because it was therapeutic for me to explain my situation. This book is a very emotional, visceral book. And so for me, it was getting my emotions, getting my experience on paper. It helped me, and I felt like if it could help one other person, then I was successful. The message of the book is you have to advocate for yourself. We live in an incredibly complex medical system where doctors spend less and less time with their patients and are more and more dependent upon tests. I mean, I'm a physician. I hate to say this. The days of Marcus Welby, where your doctor did a thorough clinical exam, listened to you, are fleeting. I'm not going to say they don't exist, and I happen to have my medical team is outstanding, but you have to listen to your body, trust your gut instincts. If your gut instincts tell you that the answer you're getting is not right, that stress is not the answer, seek additional help. Don't stop. Trust your body. Be your own advocate or get somebody who can advocate for you, because you may not be understanding of medicine. You may not know the medical jargon, but you know your body better than anyone else does. I don't care whether your doctor has a Harvard degree, Stanford degree. You know your body better than anyone else. Do not abdicate the control that each of us have over our health. I took prescriptions. I had a defibrillator. I did what my doctors wanted me to do. But I also knew that there's a lot more to healing. The title is Gone in a Heartbeat, A Physician's Search for True Healing. True healing is a team effort, your doctor and you. There are things that we have control over. I took control over my life. I took supplements that I thought would help. I exercised like crazy. And I lived 11 years with 10% heart function, well beyond the expectation, because I took control over my life.
Dr. Spector, you went through hell. I mean, literally and figuratively. And it could have been prevented if only they had diagnosed Lyme disease soon enough and treated it effectively enough. You would not have needed a heart transplant.
Yeah, I don't think about that. People ask me that all the time. And this is the proverbial, I hear this from my cancer patients. sometimes that cancer was the best thing that ever happened to me. My life changed 180 degrees after this diagnosis or with my illness. So I changed professions. Night and day, I was working on my own little research project at the University of Miami. I wasn't particularly happy with what I was doing. I went into drug development. It really made me look about what I wanted to achieve in my life. And I ended up, again, with 10% heart functioning, developing 2 drugs, one for women with breast cancer and one for pediatric leukemia, which was incredibly rewarding to see, how many people that's helped. I have lived the story, and I've helped people through my story. So I'm not sure where I'd be had I been treated early on. I mean, I wouldn't have a heart transplant. But I think what's happened to me has made me a different person, and so much for the better, that I don't regret anything that's happened.
Dr. Neil Spector, thank you so much for sharing your remarkable story with us here on the People's Pharmacy.
Thank you for having me.
You've been listening to Dr. Neil Spector. He's a medical oncologist and an associate professor of medicine, pharmacology, and cancer biology. He holds the Sandra P. Coates Chair in Breast Cancer Research at Duke University Medical Center. He co-directs the Experimental Therapeutics Program for the Duke Cancer Institute, and he's a Komen Scholar. His book is Gone in a Heartbeat, A Physician's Search for True Healing.
That's all the time we have. Thank you so much for listening. Lynn Siegel produced today's show. Al Wodarski engineers the program. Dave Graydon edits our interviews.
The People's Pharmacy is produced at the studios of North Carolina Public Radio, WUNC.
The People's Pharmacy theme music is by B.J. Liederman.
The People's Pharmacy is made possible by Red X Industries, makers of Utterly Smooth Extra Care 20 Cream with 20% urea for extra skin protection. The number is 800-345-7339. The website is uttercream.com.
To order a CD of today's show or any other People's Pharmacy broadcast, you can call 800-732-2334. Today's show is number 996. That number again, 800-732-2334, or online at peoplespharmacy.com.
And when you go to our site, you can check out prescription drugs, herbal medicines, and home remedies. You can also share your own experience and your thoughts on today's show, as well as on Lyme disease, misdiagnosis, or advocating for yourself.
You can also sign up for our free online newsletter or the free podcast of the show. You'll never miss another People's Pharmacy program again. You can also share it with a friend. It's all there at peoplespharmacy.com. In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thanks very much for listening, and please join us again next week.
We hope you enjoyed this podcast. If so, please consider taking a minute to write a review on iTunes. And thanks for listening to the People's Pharmacy.